Today, we're going to be talking about YOPD and nutrition. And we have our regular council members here. We have Kat Hill, who is from Oregon, from a beach camping right now, which looks absolutely lovely. Tom is here, Kevin is here, and Heather is here. Hello, everybody. And our special guest today is Marty Acevedo, and she is a registered dietitian. She has so much information on nutrition, and we are really excited to have you here today, Marty. Thank you so much for being our resident all things nutrition.
Thank you.
Great. So to get us started, nutrition is a huge topic, and it is something that is nutritional choices that people make are so personal. They maybe are based on health reasons, maybe they're based on moral reasons, maybe they're based on just taste reasons, whatever it is, but it's a very personal experience. And so we're not here to tell you, you should eat this way, or you should not eat that way, or this is the only way to be healthy. Today, we're just going to talk about the sort of biology, the physical aspects of nutrition, what it's doing to your body, what it might be doing with your medication, your energy. And then the council members are going to talk about their personal experiences, what's worked for them, what's not worked for them. And we hope that you guys chime in with your experiences as well. And any questions that you have, we have an expert here, and we can't wait to get that expertise from her on all of your questions. So feel free to throw them in the chat. Marty, the first thing I want to know, first of all, Marty is an ambassador as well. And she spent a very long time. She has like a 30-year career in nutrition. So I would love to hear from you, Marty, on what got you interested in nutrition and what role did it play in your career?
Well, I was always interested in science and math. That's kind of how my brain worked, and loved food. So I kind of put the two together. Wanted to work in a hospital, but didn't want to be a nurse. So chose nutrition and became a registered dietitian, went after college, and spent the next 30 plus years of my life managing the nutritional needs of the critical care patients in the hospital. Also was involved with leadership and trying to get my staff to understand that what they did, everything they did with preparing food for patients, it really impacted the patient's ability to recover from illness and injury. So it's very, that's who I was, basically.
Yeah.
Nutrition was what I did.
So you are a medicine doctor, or a nutrition doctor, right? Medicine is food.
Yes, it is.
So you had all of that background and so much expertise. When you were diagnosed with Parkinson's, did you change up your diet? What did you do?
I did not. I've always felt that I needed to live my life by example, because if I was not following, eating the right things and making good choices, using moderation in my decisions, that I wasn't going to be a very good example for the people I was talking to. What I did do was live a more healthy lifestyle and incorporated daily exercise into my lifestyle. And I think that's really important to note, that I didn't really go on a diet because people go off of diets. I changed my lifestyle to be more healthy for lifelong.
Great. I would love to hear some of you all share your experiences around how food has impacted either your motor symptoms, non-motor symptoms, anything like that. Does anybody have any experience with trying to experiment with different things? Heather.
As someone who also has celiac disease, like the late Tom, our hero Tom, the gut microbiome is crucial to us, not only processing our medications, but also our overall health. So since nothing happens in a vacuum, we're talking about overall health here. This can be a useful conversation to everyone by finding more nutrient-dense foods that are specifically good for our own systems and keeping diversity, which is important in everything, in our food. We will be doing okay. And Marty's going to talk more about that, I'm sure. So I'll leave it to the experts to give us the details.
Kat.
So when I was first diagnosed, I was trying to avoid starting medicines right away. So I tried to look at the things I could impact myself in how I was feeling and taking care of myself. And I had, like Marty, I had a pretty healthy diet, but I did do some food journaling and journaling of symptoms to see if I could impact the way that I was feeling based on what I was putting in my mouth. And while I noticed what I was eating didn't seem to have a direct effect like on my tremor. I did find that it helped a lot of my fog brain symptoms and also headaches and heartburn. So even though some of those may not be direct related to Parkinson's, it's directly related to how I was feeling. And so by eliminating or really decreasing the amount of gluten for me, and again, I'm not promoting any diet, I'm not promoting anybody change what they're doing, but for me personally, it really decreased the amount of headaches that I would get. And I had a lot of migraine headaches for many years. And it also completely got rid of my acid reflux. So that was really good learning. And I've kind of tested it a few times. I'll go kind of on a, oh, I'm gonna try just eating what everybody else is eating for a while. And sure enough, both the headaches and the reflux come back. So I've done less and less experimenting and just kind of stick with a mostly gluten-free diet. Unlike Heather, I do not have celiac, so I do not get ill immediately, but I do over time find that accumulation of that. And I try in general to eat the foods that I can pronounce, or foods that I understand what's on the label. It's just been a really good way for me to eat. So it was trial and error and my own experiment, but I love that we're having this conversation. Thanks for being here today, Marty, with us.
Yeah, absolutely. Tom.
Yeah, that's good points that Kat makes there, and of course Marty as well. And Heather, I think we're all kind of into this, how it affects us individually, of course, just by the nature of Parkinson's. But when I was first diagnosed, I had, instantly started reading about Parkinson's disease, and it had all this stuff about not eating protein. And I asked my doctor about that, and she said, "No, that's not going to really come into play until you start taking meds." And she said, "Don't get too wrapped up in the eating thing until you get a little farther along." In other words, she said, just keep your diet the same if you're eating healthy already. And we do already be fairly healthy. And she said, then as things, you'll notice things that'll change. And sure enough, I really have had a lot of effects from different things that I eat. So we eat far less red meat today than we ever did before, or than we did before. And different things like that. So I do react today, because I take a lot more cinnamon than I did years ago, to the effect of protein. So I've become cognizant of those things. But again, I think the point I'm trying to make was what my doctor stressed to me was, take it day by day as you go along, because things are going to change. They're going to change all the time. And you may have to change your diet quite a bit. The other thing that I did that was really had a pronounced effect was starting to take probiotics. Mm-hmm. And I think Heather brought it up earlier, the gut biome part. That totally changed things. I mean, it really changed the landscape quite a bit. Now, the only thing that I can't seem to live without that still impacts me is peanut M&Ms. So I'm sorry, I'm smitten. So I got to put up with a little bit of discomfort just because I like peanut M&Ms.
No bad foods.
Absolutely. Absolutely. Yes, Marty, no bad foods, no bad foods. Kevin, what about you?
Yeah, so I had the luxury of having a girlfriend who's very involved in not only what you eat, but the sourcing of how you get it. So she's very big onto grains and understanding the source of certain grains and what are more natural. And more recently, I've gotten very involved in, the role of pesticides and how it affects the food system, and the actual how we could possibly even not prevent Parkinson's, but there's an implication that certain foods exposed to certain chemicals can actually increase the risk of getting Parkinson's. And so I think that there's, Tom, I know you said that you started thinking about it more after, but we may actually be doing some good to our society and our pre-brethren before they get Parkinson's, if they look at it more holistically.
Right.
Agreed. Yeah. So I want to share a comment that hi, Carl, Rob, how are you? He says, I felt better with my YOPD when I went vegetarian. my meds worked better and my digestion improved. Being protein sensitive, I do try to eat my most dense protein foods like tofu, eggs, and beans. I try to hold them maybe until the evening meal. Yeah, thank you for that. Thank you for that, Carl. Let's see. Did anybody else have anything on that, on the motor thing? I want to talk a little bit about non-motor and how you feel, how your food impacts your non-motor symptoms. Can anybody speak to anything that's like, oh gosh, when I do that,
I think most of the impacts I have been have affected the mental part or the non-motor. I've had very little impact because I don't have much of a tremor. So I've had very little motor impact on my diet other than, slowness of gait and things like that, because I'm experiencing a deeper off time because I ate too much steak or whatever, but which I don't do anymore. So but these days, if I eat too many M&Ms, I get cloudy. So.
Well, a man without a vice is a dangerous man. So you have to have something, right? I mean,
precisely.
Who are these maniacs, who do everything perfectly healthy? They scare me a little bit.
Yeah.
Kevin?
Yeah, I'm curious to hear Marty's view on this, but it's not exactly a food group, but it is more of a vice than the peanut M&Ms that Tom was talking about, is the role of alcohol. Because if I have now one drink, just even a half a beer or a glass of wine, there are times when I almost feel completely inebriated. And, I realize I've only just had a sip, right? But my whole function slows down. My walk, my gait is completely off, my balance. I mean, you would have thought I was, a wino on the streets, right? And literally, if I got pulled over, I'm sure a policeman would say, you got to go right to jail because there's no way you should be there. So, Marty, what is this inebriated state? Is that something that's just we're destined to it now as we progress?
I've always said that if I was ever pulled over, and regardless of my level of alcohol in my blood, that I would be arrested for drunk driving under the influence, because I get a tremor when I'm anxious and can't walk without, in a straight line, that type of thing. So I think it must have something to do with the dopamine production in our brain. And then once we have been diagnosed and we take in alcohol, we're all different. People tolerate alcohol at different levels based on our own chemistries, but as we progress, perhaps we're less able to tolerate the alcohol that we do take in. Not exactly sure of the physiology and the brain chemistry there, but some people tolerate alcohol just fine and others don't. So you kind of have to journal, as Kat said, and see how it affects you and go from there. As far as alcohol is concerned, there are some good qualities of some types of alcohol, like red wine has resveratrol in it that can help with antioxidants and reducing inflammation and may be neuroprotective. I'm not saying to go out and start drinking. I mean, that's not something you should do, but to use moderation in all things and being cognizant of how it affects you is really important.
Yeah, and I think as somebody else, had asked about coffee, I think it's very similar. I mean, we all have a different way of metabolizing coffee and alcohol. Some people metabolize it no problem whatsoever. My husband is Asian and he has the very common sort of alcohol allergy. And he has I can tell how many drinks he's had. I'm just like, he's not drunk or anything, but he has that allergy. He does not metabolize alcohol well. And so he gets very red and blotchy immediately. But at the same time, he can drink coffee at 9 o'clock at night and sleep like a baby. And if I had coffee, even if I had just caffeine, I'd be up for 7 days. So, everything is different. So if you're, asking about coffee or asking about alcohol, please, do the experiment, figure it out, see what happens to your body, and maybe even do like a chart where you're saying, where's my energy? How is my sleep? Can I exercise? Like, what am I like the day before? Do I feel strong? Do I feel clear in my mind? And, do a little week-long experiment. Heather, did you want to chime in here?
Yes, I just wanted to echo the sentiments of what you're saying, but also what Pam Burnett, I believe one of our listeners, was saying about how it exacerbates, alcohol specifically exacerbates the effects of the drugs. So it's like for every one, you're basically drinking two. So double it up when you do your math. Even if you're just going by blood alcohol level, it doesn't matter. And I wanted to add, I happen to know some people in law enforcement. So the last time there was an open air fair in our area, way before COVID, by the way, we had what's called the Lafayette Arts and Wine Festival. And I asked him to test me as I went in, and I was really off and shaky. And then I asked him to test me again. These are sobriety tests, by the way. After I'd had 2 glasses of wine and walked around in the sun. Guess which test I failed?
The first one.
You bet. Completely failed. Couldn't walk the line right. Couldn't do the, count by sevens. Couldn't say the words backwards, was slurring, shaky. And I had some people watching who were kind of amazed by this, because for a population that is often confused with addiction, and you know how differently addicts or people who have addictions are treated from people who have neurologic disorders, both diseases, we don't want any more of that. So to have that 1 glass, just remember it's 2.
That's good. That's really good to know.
Yeah. Go ahead, Tom.
I had a lot of alcohol had a big impact on me early on. Probably because I started more with citalopram, and anxiety medication. So that drove me off alcohol completely for about 5 years. And then just in the last couple of years, I started having a beer again once in a while. And I still only have a beer maybe once every other week or so, just because, we'll be out with friends or whatever. But I notice it doesn't impact me hardly at all anymore. So, I mean, sure it has an impact, but not like it used to. I used to get really cloudy and really fuzzy, and it was not a good thing. So I just quit altogether for a long time. So.
Good. Kat, were you going to say something?
I just wanted to say, and Marty, you're probably going to touch on this, but hydration, I think, is really, really huge in what we're talking about. And I think it's under discussed in that, how we metabolize our medicine, Heather was saying, being out and walking around in the sun, alcohol can be dehydrating, certain foods can be dehydrating. Are you going to touch on that, Marty?
Yes.
Yeah, that was
Awesome.
my next question.
Yeah, so it's made a big difference in how I metabolize my medicine. I drink an entire 8-ounce glass with every dose of medicine.
Right.
And it's funny because camping, on the way over here, I didn't have a water bottle. And I was like, I need to double up when I get here. So anyway, I'm glad you're going to talk about it, Marty.
Yeah, so Marty, let's talk about those sort of in context with meal timing and hydration, and some of the questions around protein and that kind of thing.
Okay, so protein competes with carbidopa, levodopa for absorption in the gut. Then it also competes with amino acids for transport across the blood-brain barrier into the brain where it does its work. So some people have a sensitivity to that, and often you don't have it when you first start taking carbidopa, levodopa, but you develop more of a problem with it later on as your disease progresses. So most people recommend that you not take your Cinemat or Dietary or whatever with a protein-containing meal, or you limit it. You take your medication 30 minutes before a meal or snack containing protein, or an hour or 2 after. But it's important not to limit the protein in your diet, because you need the protein and calories to sustain, to have energy, to fight fatigue, to keep from losing weight and losing muscle mass. About hydration, Kat's right. An 8-ounce glass of water with every time you take your meds is really important. You need about 64 ounces of water a day. And that's 2 liters. That's a good way to judge it. It's about 2 liters of water. And certain types of liquids are dehydrating, caffeine, alcohol, those types of things are. So you wouldn't really want to include that as part of your fluid intake. Water's the best, but you can use carbonated waters, that type of thing, flavored water. I don't really like the taste of water, but if it's ice cold and it has a slice of lemon in it, I'll drink it all day. So that's what works for me.
Great. I also wanted to mention, so Steve, usual panelist, those of you who are usually here are probably missing him as we are, but he had something to share and I just thought it was worth sharing. So he said, as our Parkinson's progresses, our sensitivity to timing our meds with meals and protein changes. It is, for him now, it has gotten to the point that if he is doing anything that he really needs to be on for after a meal that contains a high amount of protein like chicken, eggs, etc., he buffers at least 90 minutes before or after medicine to allow his medicine to really kick in. If he's eating a meal that's maybe more carb based, he gives it 45 minutes and that seems to work well. Let's see. He did say it didn't bother him in the earlier stages of his Parkinson's, but in the past 5 years, he has to be much more disciplined than he used to be. And because the situation is so important, and the importance of protein in our diets, a really smart, well-planned diet is super important. So I think, he's just mentioning it might not be what it was when you first started out, but if you start to notice maybe your medications aren't working, maybe you're off more than you used to be off, then maybe timing is a good place to start with looking into that. Yeah, Marty.
Another thing that can contribute to your meds not working as well, that's nutrition related, is constipation. Because if you're constipated, you often are not able to absorb the medication you're taking, not to mention the nutrients that you're taking in. So hydration is critically important for managing constipation, as is exercise and fiber.
Yeah, I would love to talk about constipation. I mean, love it. It's just such a great topic. But it is one of the most popular topics that we get asked about, and it's the most frustrating thing in the world. So does anybody on this panel have experience with constipation and what they have done that has worked?
I'm sure we'll all want to address that right away, right?
Yes.
It's a moving experience.
It never was.
This is a safe space. We can all talk about it.
It's a judgment-free
much
zone.
of a problem until the last couple of years for me, and it's definitely become a recognizable issue for me. And again, water is absolutely key. I've always called Parkinson's dry brain disease, because one of the commonalities I've always noticed whenever I talk to someone with Parkinson's, I always ask them, did you drink much water before you had Parkinson's? And they said, no, I hardly ever did. And I really think that plays a huge role in how the disease manifests itself in all of us. But again, I think, that water is going to be the source of a lot of your solution to solving issues and dealing with issues. A good friend of mine, a pharmacist, I was talking about this once, and he's like, dude, don't you understand that most medicines are designed to dissolve in water? So why wouldn't you take a bunch of water with your pills?
Does anybody have the memory of their parents when they were young telling them, don't drink water after like you take your meds? Like, I just remember as a young kid, they would be like, especially cough medicine or something like that, it'd be like, don't take the water. And I got so trained not to take the water after, which was absurd. Like now I'm just like chugging it. But I think it's funny, right? The wives' tales.
I think if you're treating cough with an antitussive or an anti-cough, there is some codeine effect, but that is really the exception in terms of medicines. The rest of them, if you picture swallowing a pill with just a little bit of water into your stomach, it's not like that stomach's filled with all kinds of fluid to help desorb and break down the pill. So picture putting it into a dry tummy, or stomach, and you're not going to digest or absorb it well without that water. And so maybe replace what you're thinking about water, maybe with that. And pills, they've done studies where somebody's taken a medicine and they've done an endoscopy where they go down with a camera into somebody's stomach and intestines. And sometimes they'll see a little tablet just stuck to the wall of the stomach. And sometimes for visual learners, it helps cue us. Like I'm always thinking about that. Oh, my Cinemet's going to be stuck right here. I just know it. I better get some water and flush that down.
Yeah, absolutely. Heather.
Yeah.
I just wanted to add that with gastric emptying and the gut motility, that is the answer to having the meds cross the blood-brain barrier. So sometimes, as you said, oftentimes protein will block the absorption. I find if I eat anything with my first few doses, it will block. All I can really have is coffee and maybe a few bites of toast, or it won't go anywhere for a while in the morning, especially. So you have to sort of feel how that is for your body and your timeline. What I would also mention is the gastroparesis, I think it's called, that is sort of caused by the slowing of our digestion. It sort of happens over the course of the Parkinson's journey. It's really fun. It's just one of those really fun things, you know, that not only drains us of our energies and slows us way down, like Tom was saying, if I eat a meal with a lot of, meat or something that's I'm slower to digest, but it will keep us from enjoying everything. It's not just the Parkinson symptoms that'll get worse. It'll be everything. They've done studies where after people have been put in to psychiatric care for a lifetime, like people who are labeled mentally ill and have different illnesses, they've done a study on them. And when they do their biopsies and when they do their post-ops and everything, they all share one thing in common: gut problems. Every single patient. So it does cause non-motor symptoms as well, and foggy thinking, and even mental illness. So take care of your gut.
Absolutely.
I wanted to answer the question. Sorry, Heather. The constipation part. So I'm willing to throw it out there. When I travel or I'm not eating my regular diet is when I can have troubles with constipation. And so what I notice when I'm traveling is I'm not eating as many raw foods, apples, oranges, things that don't travel as well, things that get mushy in my pack. So I try to be really, really good about water, exercise, and roughage in my diet. And if I pay attention to all of those things, I seem to be able to avoid troubles with constipation, at least at this stage of the game, knock on wood. But it's like raw whole foods, peelings. Yeah.
That's a really good point, Kat. And I think I've experienced exactly the same thing that you were talking about, and you too, Heather. And the other thing about water with your medications is you got to get it to your gut first. And that takes, in the morning, you're dry. That first, if I don't take my pills with a good glass of water or two, I can feel them not getting down there. And then like you, Heather, if I eat something beforehand, a bagel will just stop the process. So I always eat after I take it, about 15, at least 15 minutes to half an hour after I take my meds. First thing, go to the bathroom, the meds go down, 2 glasses of water just to make sure they get there. And that if I start my day that way, it's a good day.
Kevin.
I'm curious. I want to ask Marty this question. Are there such things as pro-dopaminergic foods? I've heard, like, for instance, eating raw eggplant actually can result in the formation of more dopamine, but is that more just a myth or is that real?
I'm not aware of anything that's pro-dopaminergic. What you describe as eggplant is a nightshade type of vegetable, and those do have some antioxidant phytochemical type properties. So maybe that's what's helping with that, because those are the things in the Mediterranean diet that we know are helpful with inflammation and can be neuroprotective. So maybe that's what the process is there. I just wanted to mention also that not everyone with Parkinson's has to deal with constipation. There is a subset that actually has something called irritable bowel syndrome diarrhea, or diarrhea and constipation, where they go back and forth. So some of us, myself included, I don't have an issue with constipation unless I take a certain medication. So, we have to deal with diarrhea and other things that we're intolerant to, certain things like gluten in some cases, or dairy, lactose in other cases. And then just, regular eating can cause problems. So that's why hydration is important with that, as well as is fiber, as is a good balanced nutritious diet that's based on moderation and balance.
Right. And we can't talk about constipation without talking about exercise. So one of the best ways to get things moving is to start moving yourself. I want to just share this comment from Angela Robb. She says, autonomic dysfunction seems to play a role in reducing the thirst mechanism for some people. So as a care partner, I do help Carl by cueing for water consumption. I think that could impact folks at any time during the YOPD continuum. Yes. Absolutely. And I love that idea of just queuing for water, and whether that's something that you have on your own, you have on your phone, you're just always taking a bottle with you, or you have a care partner who's going to say, hey, guess what? It's time to drink. That's something to keep in mind. Over the counter. I wanted to talk a little bit, because you mentioned the Mediterranean diet, and we often have lots of questions and lots of people experimenting with different diets, and they say, is the keto diet is best, or the vegan diet, or vegetarian, or whatever. So what is your thought on those diets? And since you're not a diet person, the Mediterranean diet, I always give a disclaimer and say that's actually what it's called, but we don't like to say the diet. We like to say nutritional choices, because we want it to just be something that's, you're always on. But Marty, what about all the different diets out there?
Well, Mediterranean lifestyle is what I like to promote, which includes exercise, plenty of water, getting out in the sun a bit, and then diets based on antioxidants and phytochemicals, fiber, and that type of thing. There are other things that people try. Kat has benefited from a gluten-free diet, as is Heather, because of celiac disease. People are intolerant or have sensitivities to certain types of properties in the foods we eat. So it's good to identify those by journaling and that type of thing. There was a push for people with Parkinson's to maybe consider a keto diet, which is a ketogenic diet. And there was a study done on 5 people in Samoa where they followed a strict ketogenic diet with about 92% fat and a little bit of protein and almost no carbohydrate. They did very well. Their Parkinson's symptoms improved for the 28 days they were on the diet, and again for another 28 diets after they went off the diet. But that was 5 people in a very isolated area, and it's very challenging to follow that diet. You have to follow it 100%. You can't vary from it at all. It's a diet that's used for kids with seizure disorders, and it tends to work for them as well. So that's what the basis for that is. Vegan, vegetarian diets are great, as long as you make sure you're getting adequate and proper and the appropriate types of protein. They're kind of based on a Mediterranean style of diet. There are lots of vegan and vegetarian foods that are not healthy. My daughter's vegan, and she knows every single fast food, junk food type thing that's vegan, like Oreos and Doritos are vegan. So you have to be careful with that. Just because it's healthy doesn't mean that everything about it is healthy.
Yeah. And can we talk about how a Dorito is vegan? It's nacho cheese. What is going on? How is that possible? Let's just all consider how terrible that is. And a white filling. I don't know. It just seems like there could be dairy in there. So this is an interesting tip. Jackie, she's a music therapist. She works for the Davis Phinney Foundation. And she said, a tip I used for patients needing water in post-operative recovery was to listen to a song and take a drink of water every time they heard a certain word. So if you're somebody who struggles, give yourself that challenge, give yourself a trigger each time you need to drink some water. Someone says, can someone speak to dairy in their diets? And what about intermittent fasting? So dairy, I want to have Marty talk about that. But again, like all of these things are so personal. Some people have a really, really hard time metabolizing dairy. Some people have no problem whatsoever. So let's talk about that, Marty.
So there have been studies done on dairy and as being a cause of Parkinson's. There's a relationship there that has been established through some observational type studies where people actually did surveys of if they drank milk or dairy and that type of thing. But there's no the research hasn't shown any direct implication with Parkinson's caused by dairy, or that taking dairy in will cause your Parkinson's to worsen. That said, there are many of us, myself included, who are lactose intolerant and have significant GI symptoms when we take in dairy or anything, cheese, milk, ice cream, those types of things. So you have to be careful for that. So it's very individualized, just like Parkinson's is different for all of us. So is the way we metabolize foods and the nutrients that we take in. The other thing about milk is that I noticed someone in the comments has it made their phlegm thicker. The fat in milk can cause that to thicken up. So if you're able to tolerate milk, it's to use a low fat or non-fat type of milk. It will thin up your secretions a bit.
Great. Oh yeah, Kat.
So when I also, because I did a lot of reading about the inflammatory aspects of dairy, I have found it fairly easy to shift some of my diet to non-dairy substitutes, and I've been really happy with those. There's almond and cashew-based yogurt that I really like. I'm trying to think what else. There's a couple things that are harder to substitute, but I don't really find that I miss it very much. I still will have an occasional ice cream, real ice cream, but there are some great non-dairy ice creams also. Again, cashew is my favorite because it's really creamy. I find that because I don't taste as well, because of the Parkinson's and losing the smell, that texture has become more important to me. So I've done a little trial and error and have found some substitutes that work really well for me. And I find same kind of thing with less gluten. I'm not as foggy brained. I'm not as phlegmy. And, you know, for what it's worth, I think there's some great non-dairy substitutes out there.
Kevin?
Can we talk a little bit about this issue of not being able to smell, how it affects taste? Because I have friends who tell me, let's not waste the good wine on Kevin. Just give him the cheap stuff because he can't taste it. And I swear I can taste good and bad wine. And I can taste the quality of foods too. So what's this issue of hyposmia affecting smell and taste?
Well, your smell, when you can't smell something, it does affect the way you taste things. And also taste is impacted by Parkinson's. It impacts our ability to taste sweet and salty, that type of thing. So sometimes people crave sweets when they have Parkinson's because they just don't taste it. We too can taste bitter and sour pretty effectively, but the other things are impacted. I still have an intact sense of smell, so I can't really speak to that. I'm lucky that way, but taste and smell go hand in hand together. So
That's interesting because I lost my sense of smell years ago, but like Kevin, I can still taste things really well. I mean, I can taste the difference between like a Diet Coke and a Coke.
Yeah.
You know, very subtle differences. So
yeah,
we're all different.
And if you
but
think about
I can hardly smell anything. I smell dirt, smoke, and leather.
Mm-hmm.
And if you think about the experience of eating, it's a very sensual experience where you are smelling it first, you salivate like the Pavlovian response, and then you get your gut moving that way, right? Doesn't that sort of get everything moving? So if you're not smelling it and taking it in, it would be the equivalent of having, you know, something that is just a color and something to look at. You can't enjoy its full sensual experience.
Exactly.
And I think I find my sense of smell is severely altered. That's probably a better way of saying it. Or my sense of taste is altered. It has changed significantly since my diagnosis. And I think it's impacted by the lack of smell. So it takes more flavor sometimes for me to notice a change, but I still do have some sense of taste. So I like to think my sense of taste is heightened in other ways, perhaps visually or kinesthetically, maybe just not orally.
So all this eating, can we talk a little bit about chewing and swallowing and some of those challenges that people have? What is going on with people with Parkinson's that are struggling with this? And what are some strategies that people can use?
Well, bradykinesia, slowness of movement, and rigidity both can cause problems with swallowing at the vocal cords as we get older, as Parkinson's progressed. Parkinson's was described to me once as a accelerated aging, a disease of accelerated aging. So the symptoms can happen both with aging and with PD. But so what happens is if your vocal cords get weaker, and they are muscles and they're not as able if they're not strong enough, they can't protect your airway when you swallow at times. And so you're at risk for aspiration or food going into your lungs instead of into your esophagus towards your stomach. So that's a problem for people with Parkinson's. So that if you're having trouble with swallowing and chewing, it's related to your Parkinson's, your motor symptoms, as well as your autonomic nervous system and being able to the motility in your gut is reduced. You might want to seek a special consult with a speech pathologist, because they can evaluate if you have real problems with your vocal cords or your swallowing, and identify ways to work around that and strategies so that you won't have any fallout from that, like thicker foods, no mixed foods, no casseroles, and sipping with your chin tucked, no straws, those types of things. It's really important to address the chewing and swallowing issues, because if you're not able to take in adequate nutrients, you're going to put yourself at risk for losing weight, malnutrition, and then that starts a whole cycle of not being able to maintain a healthy lifestyle and having a poor outcome.
Heather?
I'm also noticing that when I'm in public in a really fancy place, that's when I choke. And when you're choking, like there's a date or somebody there, you're trying to impress your date, and you've dipped your thick gluten-free bread into this like shrimp dish that's really spicy, and you bite it and your throat gets all dry, and suddenly you're like, and during COVID, of course, you look like you're coughing. It's disastrous. Between that and the incontinence, I mean, forget it.
You're telling me your dating book is not full right now? You're not
They're
ready
just
to go on like
They're
100
just lining up.
dinner
Man. They're
dates?
lining up.
Well, it will be now.
At least I'll get a good laugh, right?
Actually, well, I think that's too big of a topic to go into right now, but does anybody else have swallowing or chewing issues, and what have you done?
I saw a physical therapist or occupational therapist for that many years ago. And the best advice she gave me was, just slow down when you eat, which I did naturally because I can't move quickly like I used to. And, and I find myself chewing things up more completely than I ever did before. And then the best piece of advice she gave me was swallow with purpose. So when you swallow, hammer it down. And that's changed everything. And if I don't, I end up sitting across the table from Heather. Yeah, right. I know exactly what you're going through. It's a horrible feeling.
Kevin?
Yeah, one of the things that I've noticed over time is I cannot drink out of a bottle. It's that act of lifting your head high, tip over, somehow weakens my muscles for swallowing.
Right.
And I found that if I actually put something into a glass and use a straw, I'm more able to swallow it completely.
Heather made a comment about mindfulness. I think that's really important to practice mindfulness while you're eating, so that you're really enjoying the flavor and the taste and the texture of the food, and it makes you slow down. So that if you're, it will make you not gobble down a piece of shrimp. That I did that just a couple of days ago. A piece of shrimp got lodged, and I was doing a Heather. So it was awful.
Doing a Heather. I love it. I have trouble. I always find that if I'm in a conversation at dinner, which I often am with my family, if I'm thinking about what's being said rather than taking the time to swallow, that's when I have trouble. I have to be more mindful about swallowing before responding or talking. So, which is it's not my strength, I will say, but I'm learning.
Does anybody use gum or sugar-free suckers or anything to just kind of keep that swallowing going? No?
I chew gum still pretty regularly, and I do okay there.
Mm-hmm.
Usually if I choke on something, it's water, and it's almost exactly the situation that Kat described, where I'm in a conversation, I'm trying to keep up with everybody. And so you're trying to swallow it fast, and I end up inhaling, and gets ugly for a few minutes, and then it kind of lasts for a little while until you get things cleared out. But I just know Steve just said something about helping with the drooling. That's important too. I don't drool, but I can see that working well too.
Yeah, and Betsy says my person with Parkinson's always has hard candy nearby. I think for some people, it works.
Be careful. Be careful with the hard candy, though. That's
Mhm.
exactly the kind of thing you could swallow if
Yeah.
you're not paying attention, too. So,
Right, exactly.
yeah.
Very true. Very true.
And my dad would chime in, sugar-free is better, because he was a retired dentist with Parkinson's that had
Oh, wow.
drooling issues. So that's there you go, Dad.
There's your
So,
PSA.
There
We
we go.
all agree. Good job. Okay, so, from Carl, I think of gratitude when I eat as well. Appreciate all the work in the food. Yeah, that's awesome, right? Does any, let's see, Marty, what have we not addressed that you think is super important for us to talk about?
Just the re-emphasizing the importance of hydration and exercise. That's part of our healthy lifestyle. Without those two things, whatever, your nutrition is not going to be, it's just a piece of the puzzle. And then weight loss and weight gain is very prevalent in our community. People either tend to lose weight, or then after DBS, like I'm a prime example of someone who gained 20 pounds just like that. And my diet, what I was eating didn't change. I was exercising more, but I still gained the weight because I think my resting expenditure of my energy went down because I didn't have that internal tremor any longer. I wasn't dyskinetic any longer. So that all shifted. So that's something to think about. I would do DBS over in a heartbeat, no matter what my weight was going to be. But you have to be mindful, again, that word, of what you're eating and how your situation is changing. Because as we grow older, metabolism's slow as well. So adjust to that. And then the importance of depression and apathy, and the ability to eat appropriately, exercise appropriately, drink enough water, and all of that type of thing. It's a non-motor symptom that's not well discussed. It's something we don't talk about enough, and I think it really can impact people if they don't feel like doing anything. If you're apathetic, you have to really make yourself get off that couch and go outside and do 30 minutes of exercise, drink water, and eat the right foods.
Right. Heather, and then Kat, and then Kevin.
Just quickly, someone had mentioned, what about the drug interactions? There's one called Reglan, R-E-G-L-A-N, or metoclopramide, I don't know how to say it, that does block dopamine and unfortunately makes Parkinson's symptoms worse. And yet this is regularly prescribed for patients to get their gut moving. So always cross-check everything with your doctors. And remember that your doctors aren't talking to each other.
Right.
So you have to be your own advocate. You have to do the work and cross-check this with all the Parkinson's friends that you have. Just want to add that.
Yeah, and actually, can I ask Kevin about that? So Kevin, that feels like a real pharmacist question as well. Is that something that a typical person can discuss with their pharmacist to say, hey,
Yeah, I think most pharmacists would know, not so much Parkinson's issues, but issues like metoclopramide and its effects on your gut. They should be. A pharmacist is always a good friend to have.
At least two.
At least two pharmacists?
Yeah, I just happen to have two friends that are pharmacists, and
nice.
they become best friends because of all that. Totally the case.
Yeah,
Kat?
sure. I just wanted to mention too that for those of us that are diagnosed around perimenopause, also the shift in caloric needs really shift after menopause. And so just being aware of that. And again, it's back to mindfulness. It's back to all the things we're thinking about, but you could be eating exactly the same amount of calories before menopause and suddenly need significantly less after menopause. So that can throw just an added element of awareness, right? An opportunity for growth and learning again.
Kevin, what were you going to say about that?
Oh, I have a lot of questions for Marty, but I wanted to know whether or not that we talked a little bit about foods that might cause inflammation or anti-inflammatory foods. And also, are there foods that actually can help with cognition, like lion's mane, mushrooms, or what?
Well, anti-inflammatories are berries, fruits and vegetables, grapes would come to mind, whole grains, that type of thing. Fish rather than red meats. Turmeric is a really good anti-inflammatory. It has a lot of anti-inflammatory processes. That's a spice that's used in mustard, and it's also used in a lot of Indian food, curry, that type of thing. There are other spices. Rosemary is a good and has good properties. As far as brain foods, that I think Heather mentioned, sauerkraut and fermented foods, kombucha, that type of thing. Those are all good things that can help to be neuroprotective. Eating a balanced diet, making sure you're getting adequate proteins, calories, and nutrients from real food, not from a processed food or a chemical, not taking a pill instead of eating the real food, can all help with making your brain more clear and your cognition intact.
Do you take supplements?
I take a multivitamin, but that's it. And, a lot of people are interested in taking extra B vitamins, and I tell them, well, you're going to have awfully expensive urine because anything that you don't use, you'll just pee out. So that's one thing. And then the fat soluble vitamins, A, C, and E, are also have antioxidant properties, but if you take too much of them, then you'll store them in your liver, and that can cause other problems as well. So it's good if you're going to take a supplement, it should be in a you should only take a single nutrient supplement if you're deficient in it, or if you know that you're having problems.
What about protein shakes? I do a lot of protein shakes for workouts.
Mm-hmm.
Is that bad because it interferes with your medication? And
that's something that you need to journal and see if it's affecting your symptoms. If you're having more off time after you've taken a protein shake, it may not affect you at all. There's no problem with that. Some people say that you need to refuel with exercise. So that could be a good source of refueling.
Yeah. Kat?
Just wanted to bring up something that we didn't touch on, and that is intermittent fasting. Marty, what are your thoughts about that? Is that something we should be trying for trial and error or not?
That has the same basis and research as the keto diet, where you're actually putting your brain into a ketotic state, which when I was working in the hospital, we really tried to avoid ketosis in our patients because it can be harmful to the kidneys and other organs, and it's not good. The brain needs glucose to operate appropriately. And when you're in ketosis, it's relying on fat and glycogen stores. So that's the premise behind the intermittent fasting. Some people have found that that's successful for them. Their symptoms have improved, and it's just something that people need to try, and it's on an individual basis. I can't say one way or the other. There's not a lot of research that's been proven on it, but if it works for you, then go for it. Just make sure that your diet's moderation, as I always say, in all things.
Yeah, I found just simply slowing down and enjoying what you eat.
Yeah.
I eat a lot less because I eat, my body recognizes when it's full at a normal pace. Usually you're eating and you're full, but you don't recognize it until several minutes later. You tend to over-release. That's how I used to be, but that's really changed everything. Just eating slowly, enjoying what I eat, and that's really helped me avoid bloating, constipation problems, and all kinds of issues. So, I feel really good diet-wise. I've done really well there. I think over the last few years, as my body has changed with the different kind of medications and Parkinson's has progressed even more. So, I'm keeping things in a pretty good balance.
Great. A couple of questions regarding supplements and vitamins. Should they be taken with medication or separately? Does it have any impact on absorption? And then the other question is the best foods to gain weight that are also nutritious.
With calcium, if you're taking a calcium supplement, you can only take so much of that at a time because it's not absorbed well. If you take too much of it at a time, I think it's like 500 or 750 milligrams of calcium at a time, and split that up. As far as it interfering with your other medications, I don't think so. But if you notice that you're having more symptomatic after taking it, then that's a problem. then note that. Also, with gaining weight, just having more frequent meals, smaller meals during the day, adding shakes like Kat does, snacks throughout the day, healthy snacks, those types of things. Those can always help. You can also use commercially developed supplements like I won't promote one over the other, but you can combine them with ice cream or non-dairy ice cream to make things. One thing we didn't talk about was the gut biome that Heather had mentioned. We all have bacteria in our gut, and most of us with Parkinson's have certain types of bacteria that are higher in us than other people do. So that can contribute to possibly that's where we think alpha-synuclein starts and goes to the brain and can cause a Lewy body aggregation. So that's something we need to be aware of, and that's probably a whole nother session just to talk about the gut microbiome.
Yeah, and just so everyone knows, we are going to actually be talking to Dr. K on constipation and the gut in one of our main webinars, and he's just so good with that. So I think we're doing that in the next month or so. So stay tuned for that. Does anybody have any final thoughts or pieces of advice or anything before we wrap this up today?
Just want to thank Marty for coming. I think it's been really informative. I know that I've learned a lot. I learn a lot every time I come, every time I log on.
Me too.
Thank you for joining us, for sure.
Me too.
Thank you, Marty.